I'll never forget meeting Jennifer. She was a patient I saw who had recently moved to town and needed a new rheumatologist for her lupus. Jennifer was in her early 40s and had been living with lupus for years. Now, when I'm meeting someone for the first time who has had a condition for years, I still want to hear about what was going on when they were first diagnosed. Not necessarily because I think I'm going to change the diagnosis, but because hearing that diagnostic story helps paint a picture of what they went through and the flavor of their condition. So Jennifer told me she had had many of the classic lupus symptoms, the joint pain, rashes, and fatigue, and that her, quote, blood tests were positive. None of that sounded abnormal to me. Now, the old clinic I used to work in was freezing, and during her visit, I could see her fingers were turning white. I asked her about it, and she just brushed it off, that they'd done that for years. Raynaud's, which was what was happening to her fingers, can happen in lupus for sure. But when I started looking closer at Jennifer, I could see that her skin felt a little tighter around her fingers, and the old blood test results that she had brought in with her showed that she had a very high positive RNP antibody. I asked her if anyone had ever mentioned mixed connective tissue disorder to her, and she had no idea what I was talking about. So I explained to her that MCTD is another autoimmune condition similar to lupus, and that it is an overlap condition with features of lupus, scleroderma, and myositis. I then explained to her that what I saw a number of clues that pointed towards MCTD versus lupus, mainly the Raynaud's, the skin changes, and the positive RNP antibody. I let her know that the distinction between the two was important, and although it didn't necessarily mean we needed to overhaul her treatment, it did provide a map. It told us to watch for complications like fibrosis in her lungs or esophagus, things that lupus alone wouldn't really make us consider. Jennifer's story is a reminder that clues like Raynaud's or skin changes shouldn't be ignored, and that we shouldn't just assume new symptoms are from lupus and we just have to deal with them. They can lead to a more accurate diagnosis and ultimately better care. Have a great day.